currently one of our valued NIDA T32 postdoctoral fellows and is working at the intersection of substance use disorders and food, obesity, and basically has been following that path for some time. She basically was at Penn as an undergraduate, then her Drexel graduate work led to a postdoc at UCSD, and then we dragged her back, or she came back to the East Coast and is doing this postdoctoral work with Reagan Weatherwill and Terry's lab primarily, but I feel I know her well because actually her master's, you know the title of your master's, Allie? The Way to Her Heart?
Um,
Yeah,
Not off the
I'm,
top of my
I'm teasing you. So there was a paper that come out of her master's work that we helped with back when, where basically she was able to talk about the interaction of having had a delicious milkshake food, not in this case rats with sugar water, but something sweet, and where some people have that, they now are sort of a little more satiated and a little less interested in things that would remind them of that food. Some subgroups of people are not, and they're actually still pretty persistently reactive. And I think that the way Allie, the title we came up with was The Way to Her Heart. And it talked about the fact that for some subgroups of people, having had something sweet to eat actually might put you in the mood to be more persistently reactive to food or non-food romantic stimuli. But that's not the topic today, except to tell you that she's had a path here that involves sweet things for quite a long time. So, Allie, today you're going to address one of the big controversies in the literature for a long time. We were saying Serge Ahmed's got a lot of paper trail around choice of drug versus sugar water and other sweets. So if you want to tell a little bit about that, we're all interested in hearing it.
Sure. Well, thank you so much for the introduction. The article today that I'm going to be talking about is Pharmacokinetics trumping pharmacodynamics during cocaine choice. And I chose this article because I had, when given sort of the recommendation, the request to look at sort of preclinical animal kind of studies, the first thing that came to mind were these sort of food versus drug choice studies. So I'm looking forward to talking a little bit about this. The background it essentially focuses on the fact that, the dopamine hypothesis of addiction suggests that given that drugs of abuse will stimulate dopamine release in the ventral striatum, that there will be downstream effects of this, of this action. You'll see downregulation of dopamine receptors. You'll see reduction in dopamine neurons, which arguably lead to more addictive-like behavior as people try to take their drug of choice more often in order to kind of get themselves back up to baseline. And however, when you do sort of when rats are trained on to self-administer drugs, particularly cocaine is kind of the big one that gets used in these kinds of studies, but also other kinds of drugs. When given the option between drugs and non-drug kind of rewards, the rats will almost universally will start to pick food or the non-drug rewards. Typically with these kinds of studies, people they are given access to things like sugar water, but they're also given access to Crisco mixed with sugar or Oreos or all sorts of very highly palatable foods. And even sort of the most basic sugar water type studies, rats tend to choose that over cocaine. So of course the sort of lay press interpretation of this is that obviously sugar must be more addictive than cocaine. or that all of these, that food is clearly, more potent in some way, which we know to just be fundamentally untrue. And it's been one of my pet peeves for a very long time because it's something that, gets cited a lot in dieting literature. It gets cited a lot in general, when talking about brain response to highly palatable food, that given this relationship between given this differentiation that rats show between sugar and drug, that it means that the sugar must be that much more potent or palatable. And up until now, the one of the interpretations that we've made is that well, cocaine, if you take cocaine or a drug, um, to a certain extent, it no longer is pleasurable. There's kind of a ceiling effect to some of these substances, whereas you can't really max out your sugar water intake. Um, but when I went to look for sort of the original paper that I knew of that was looking at these kind of questions, I came across this one, which came out, I think, about less than 6 months ago. Um, and the hypothesis in this paper was that pharmacokinetics played a fairly large role in this choice behavior. In general, rats prefer a smaller, sooner reward to a larger, later reward. In other words, they have very high delay discounting. Delay discounting, in general, means the tendency to devalue a reward the longer you have to wait for it. And humans do this. Lots of animals do this. We do this particularly. It's tested it with money in humans, but it's also evident in using commodities like food or drugs. But rats apparently will do this on the order of seconds. So, given that drug reward takes tens of seconds to kick in as compared to sucrose, the hypothesis was that it just simply took too long for cocaine to kind of act in the brain. Now, it's impossible to reduce this lag time, and I'll talk a little bit more about that later. And it's hard to increase the time to food reward. It's without knowing the exact timing that the drug would kick in. So however, similar to humans, when both rewards are delayed enough, rats will choose the larger reward. So, for instance, for humans, if you gave someone the option of $1 today and $5 next week, there might be some debate, about whether you'd choose one or the other. But if we pushed everything out a year and said, would you like $1 in a year or $5 in a year and a week? Most people will take the $5 because what's an extra week if you're waiting a year? Rats will do this, again, on a much shortened timeline. And this phenomenon is called preference reversal, that even though the difference between the time periods that one would get each reward is the same, it's still a week at, immediately versus a year. Given that it's been a much longer delay for both of them, will tend to choose the larger reward. The preference will reverse. So to test this hypothesis, the authors started out with, I think, 55 male Withstar rats, and they did a standard sort of acquisition of cocaine self-administration trial, and then followed that with drug reward omissions to try and determine what roughly the delay might be for cocaine self-administration. And then they did a preference reversal experiment where they trained those same rats on a sucrose solution, self-administration of a sucrose solution, and then did a standard choice training to kind of determine the rates that rats would choose sucrose over cocaine or vice versa, and then added a programmed delay. And ranged that delay from 10 to 60 seconds. And what they found, this is kind of a busy slide, I apologize, but when they ran the omission response paradigm and found that the omission responses were really variable. And didn't really change a whole lot with the dose, with how much cocaine they were getting. But in general, the mean omission response times ranged from around 20 seconds to somewhere in the neighborhood of 100 seconds, 90 to 110, 150 seconds, depending on dose. Adding sort of a delay between the response and the drug infusion increased the omission response time roughly by about the amount of time that was sort of close to the added delay. And I apologize if you can hear my dog scratching at the door. This suggests that without the delay, the omission response time is roughly sort of when the reward is hitting them. So essentially what it comes down to is that for each rat, there's a bit of a range in terms of how much in terms of how long it's taking for the drug to sort of have an effect on the brain. I'm going to let my dog in before she starts barking at me. I apologize. So yes, there's a big range of response times. And so, which makes it difficult to kind of nail down when you would administer, say, a sucrose reward in order to make it so that the two rewards hit at the same time. It kind of confirms this hypothesis that trying to sort of match them up would be really difficult. Doing the cocaine versus sucrose Sweetwater choice, they got very similar results to prior studies that showed a rapid development of preference for Sweetwater. So this was a 10% sucrose solution, which I've used myself in prior studies, and is not particular, it doesn't even kind of reach the level of like Country Time lemonade sort of thing. It's not a super sweet level of level of sucrose, but rats will still choose this over cocaine. So by the end of training, I think there were 3 rats that were indifferent, that would kind of go back and forth, not really showing a full preference for either one. But none of the rats showed a solid preference for cocaine over Sweetwater. And one of the things that they noted was the amount of the food reward that was consumed was kind of at the max for all of these rats. They then ran the preference reversal trial. So they programmed a delay for both of these rewards up to 60 seconds. And what they found was, the rats became more hesitant. They became slower to make any kind of choice, and occasionally would max out the amount of time that they had to make a choice. So they would, the queue would be engaged, and they wouldn't choose either one for. I think they had access for about 5 minutes. Overall, cocaine choice increased and eventually reversed. The preference reversed in comparison to sweet water. And that happened most notably, I think it partially started to occur at 40 seconds, but it seemed like the 60-second delay was the most effective in creating some level of preference reversal. There were still, I think, based on the number of rats who didn't get excluded by this point, I think there were 19 rats, and 4 of them were indifferent by the end, and 2 still preferred the sweet water. But the vast majority switched to a preference for cocaine. And they note that this wasn't due necessarily to the rats not eating as much sucrose as before. They still consumed just as much sweet water as they did prior to the preference reversal task. They just increased the amount of cocaine they were consuming as well. And lastly, there was the thing that did change was their response latency to sweet water. So when there was a 60-second delay, the rats self-administered the cocaine more quickly than they self-administered the sweet water. But ended up consuming just as much sweet water as they would have without the delay. And so you see on the top here, this is the percent cocaine choice with a program delay, and on the bottom in C panel, kind of demonstrating the reversal for those rats that did in fact reverse their preference. These animals on the bottom here were the ones, I believe, that either were indifferent, or this couple that did remain, that did continue to prefer the sucrose. So their conclusion was that, one, we still don't know the exact length of delay to cocaine reward, and it seems to be fairly variable among the animals. And thus they still can't shorten it to match the non-drug reward delay. There was some discussion about the possibility for intrastriatal infusion, but it doesn't seem to reproduce the same level of reward. It doesn't seem to make the rats feel, the same kind of level of reward as if they sort of took it intravenously. There was some proposal regarding optogenetics or photostimulation of ventral striatal regions, and that could be a somewhat more immediate. But in general, trying to kind of match the speed at which sucrose is, rewarding and reaching the brain seems to be extremely difficult. But this preference reversal, this demonstration that if you sort of just extend the delay a little bit, can explain sort of the apparent disconnect between, or the disconnect that animals are choosing sort of these non-drug rewards, specifically sucrose, over a very potent substance of abuse. And so despite the greater sort of dopaminergic response to cocaine, because it's a later reward, it's kind of considered a less desirable option for the animals. They tend to choose whatever they're going to get sooner, regardless of how potent the alternative reward is. So these prior studies were effectively delayed discounting studies without knowing it. Um, and like in contrast to actual choice studies. So this kind of is a nice, very elegant way of demonstrating that, or not demonstrate, of arguing that the dopamine addiction hypothesis is not, sort of completely thrown out the window by the fact that the rats will choose sucrose, but more so a demonstration of just how impulsive, just how delayed discounting this group is. I would be interested to see, I don't think I included, but I would be interested to see if it generalized to female rats. I don't know very much about the differences between the sex differences when it comes to animal studies, but certainly that would be something I'd be interested to see. Of course, the generalization to other kinds of drugs of abuse and other kinds of non-drug reward. One of the more splashy kind of studies I'm remembering from the last year was a demonstration that if you gave rats a very rich social environment, that they would choose the rich social environment and over heroin or drugs of abuse. And they kind of I remember that getting a lot of attention in the lay press, that there was that this sort of demonstrated that, if we gave people lots of social opportunities and really sort of supported them, maybe we could sort of stem some of the specifically opioid epidemic, but certainly concerns about addiction. So I'd be interested to see if the program delay had any effect on that. And certainly, and unfortunately, this study has not gotten kind of the same attention as its predecessors, demonstrating that, or where the argument was originally made that sugar is more addictive than cocaine. But at the very least, it gives us some ammunition for arguing that, in fact, that's not entirely true, and that delayed discounting is not just transdiagnostic, but also transspecies as well. So I'm excited to talk a little bit about this study with you guys. So thank you for your attention while I talked through it today.
Okay, the floor is open for any kind of questions for Allie.
I know Allie knows about Bert Weiss's work because in the introduction you said she did part of her training at UCSD.
Mm-hmm.
And I am a consumer of Bert Weiss's work in this area because it fits with my and Anna Rose's and many of the people who worked here as clinical researchers. Our focus on relapse, reinstatement, and things like that. And you can correct me or add what I'm about to say, because it always fits into my talks if we demonstrate, as you beautifully did, the ability of actually, it seems to me that Bert used to use sweetened condensed milk.
Yes, that's another big one for sure.
Very, very sweet. And he was able to demonstrate reliably that the reinstatement from sweetened condensed milk was on a par, if I remember correctly, or close to the intensity that you get with cocaine. But the big difference comes in where you start looking at relapse, and I'm sure you've seen a lot of Anna Rose's pictures of Q-induced relapse, and that is demonstrable in this paradigm with sweetened condensed milk strongly, at least on one trial, but not multiple. The way cocaine, once they become reinstated, and there's lots and lots of data on how length that goes on, and it even accentuates with time. But that, at least in Bert's papers that I recall, sweetened condensed milk did not show such reliable intensity of reinstatement. I haven't looked at the papers recently, so maybe you can tell me if he's come up with something new, because he really has some beautiful sort of perspectives on Q-induced reinstatement, that, in the clinic, and especially according to our work for many years, that the cues are really important. But there is this difference that he has reported between sweetened flavors and cocaine.
Yeah, I'm actually, the name sounds very familiar, but I'm not as familiar with his research. But if just to clarify, it sounds like that cocaine reinstatement is much more potent than sort of the sweetened condensed milk, that it doesn't take as long to reinstate with cocaine than with the food reward.
I think what Chuck was saying is that you get reinstatement rapidly, but that the impact is not as persistent. Is that what you were
Yeah.
saying, Chuck? And rather than, yeah. So in terms of basically how powerful a reinstator it would be. And Chuck, I don't know if you were referring to a prime, like of the sweetened condensed milk to reinstate, or just a cue that had been paired with the sweetened condensed milk to reinstate. I wasn't sure which one.
He has a number of paradigms that he's presented, and they go very well with a lot of the talks that I give, where it's reinstatement of cocaine self-administration, and there's so many ways you can do that, and one of them involves time delay, but you have that incubation effect, so that I don't think that he's used. I may be wrong about this, but I don't think he's used sweetened condensed milk for the incubation effect. But it does show, cocaine rather shows this gradual increase, even as long as a year, actually, after the last dose of cocaine in the training mode, but then allow it to incubate for months and up to a year. And what you find is that there's a more intense reinstatement, or you can use various ways of measuring severity, such as ratio and barking, so forth. But I mean, it's a very important idea. There's been so many people have tried to build this into weight reduction programs, because sweetness equals cocaine basically, and but there's some very important differences, and the major one that I remember is as Anna Rose says, it's the intensity of the reinstatement and the ratio of the various size of the reward.
It would be interesting to go across these models, because, of course, the model that Allie's talking about is a choice model, and trying to understand about choice, which is a kind of vulnerability, and that's a phenotype in itself. And then the other kind of vulnerability is Chuck talking about with regard to reinstatement, whether you're triggered by a cue or by a prime. And, it would be interesting to see if animals are the vulnerable type in either paradigm sort of cross across. But I guess, as you point out, there's a lot of variability within this
Yeah.
rat population in terms of the way that they choose. I thought it was interesting that they just became slower overall
Yeah,
after
for
they went
sure.
through this. Sort of like, okay, well,
You're like, well, why even bother?
why bother, right? I mean, if everything's going to be delayed, then why bother?
Yeah, so I think, and reinstatement, I think, is definitely a an aspect of this that I think could grow out of this study. That sort of this emphasis on the pharmacokinetics that by building in delays or that not, I guess, not taking delay or time for granted with some of this stuff,
Yeah.
that the the effect of delay discounting is really strong, and it seems particularly strong in rats. Excuse me. Um, so that if that isn't taken into account, it can really sort of skew the way that we view some of these rewards, particularly the non-drug rewards, but drug rewards as well.
Right. It's
So
it's it's sort of lurking there in every potential paradigm, right? So whether
Mhm.
we're aware of it or monitoring or measuring it or not, it's potentially there. And if you set it up in the way that Serge Ahmed's papers have done for many years up to this point, as a simple choice without thinking about the pharmacodynamics, that's that's an important thing in terms of basically not having an apples and oranges situation, you know.
Yeah, for sure.
Um, Hi, this is Julie. I have a quick question. I can't imagine that someone hasn't done this, but I'm thinking back to sort of this DiChiara paper from the 80s where he, used a number of different drugs, nicotine, amphetamine, cocaine, and showed
Mhm.
dopamine microdialysis. And so I guess at a very basic level, do you know if someone has done, the equivalent with food? And I mean, for example, nicotine is much lower than cocaine. And in fact, that plays out that people have a very hard time getting animals to self-administer nicotine, right, in many of these paradigms. So I just don't know, does food have,
You know,
irrespective
Julie,
of the
yeah, I'm trying to remember the DiCara paper, which was sort of a favorite for a long time.
temp.
And I think he actually, but I may be now conflating and putting things together here that were not there, that that he may have had a comparator because he was wanting to make the point that he saw these supraphysiologic rises, right, with drugs of abuse compared to natural rewards. So somebody who has a quick Google, you can check this.
Yeah, yeah, I just did because that's what I thought so as well. But no, he does amphetamine, nicotine, alcohol, cocaine, opioids, and then bromazine, the heck that
Isn't that?
is. But
But does not have. That's so
nicotine.
interesting.
Yeah, I think it tends to, I don't, so I think my short answer is I don't know. But in general, because I come primarily from the sort of food reward world, that in general, it tends to be by itself or compared to one other thing, maybe. Um, and a lot of times there's comparisons of sweet versus fat versus salty versus all of these things versus chow. Um, but um, I think it doesn't. Um, this is also partially my bias, but I don't think it gets sort of included as often with some of the drugs of abuse as it potentially would be interesting to do so. The In the way that with a lot of studies of drugs of abuse, weight doesn't always get taken into account,
Well,
um,
it
and
happens
vice
that,
versa.
that
So, sorry.
that it happens that there's another recently deceased NIDA researcher. I must, all these friends of mine are getting to that critical age and today it was Mary Jean Creek, but Bart Hobel at
Oh
Princeton
yeah,
and
totally.
Sarah Leibowitz did a lot of work comparing sweet and non-sweet, and even and in his microdialysis paradigm, he was also looking at acetylcholine and was able to show aversion with acetylcholine and attraction with again sugar, some form of sugar, and the the people who own McDonald's were really interested in this, but I think they decided it was harmful to the weight loss idea.
Sure.
Um, but there is I just happened to spend an hour or so with Arnold D. Chiari at the last ACNP meeting last December, and we were talking about these relative things, as you know, and he said, well, you know, that made a really big um, splash when we showed the parallel lines of dopamine increase in intensity uh, uh, with the microdialysis level. But he said, you know, it really um, he felt that cocaine was still the most intense driver. Um, and so well, I like Serge Ahmed's uh, studies. It's hard to um, when you see how uh, intense the craving for cocaine is and how frequently it leads to relapse, sometimes with only very short exposure. You know, it's a bit of a stretch to compare cocaine and condensed milk.
Hmm. Oh yeah, for sure. Which is, I think, always what bothered me about some of these, at least certainly the lay media interpretation of it, but that all that it kind of bothered me about these studies because it would be it's so like of course sugar isn't as potent as cocaine, and but it was such a sort of easily co-opted and easily um, uh, sort of misinterpreted kind of result, that um, it's it led to it has led to a lot of research in the food sort of reward world that maybe isn't taking some of this delay discounting aspect into account either, with the assumption that um, um, given the assumption that, well, if if sugar water or sweetened condensed milk or whatever it might be is at the same level of potency, is leading to the same level of responding, then we need to treat it more like an addiction, and that and that's led to, I mean, some very interesting research, certainly, but whether it's taking some of the, how it could take some of the pharmacokinetics into account, and certainly whether it's taking any of it into account, is sort of debatable, and if it's possible to kind of reorient ourselves, not to say that, I'm not trying to devalue an entire field of food addiction research, but that there's it kind of adds an extra wrinkle to it, that if we've been basing this this whole idea that that of food addiction or of sugar addiction, or um, that uh, that plays a big role, um, on this idea that it's just as potent as cocaine, quote quote, um, that that maybe some of that needs to be reexamined.
Well, does anyone know any late results from the Yale food addiction treatment program for obesity, because you can go there
Mhm.
and pay for a clinical spot and get treatment,
Yeah.
and they think that it works.
Um, and I think I don't know some of the treatment outcome offhand, but I know that Erica Schulte is at CWED now. She's done a lot of work in food addiction, and the and to some extent there are certainly aspects of food addiction that that seem to track certainly if it's linked to sort of loss of control, and there a lot some of the patterns do tend to be similar, um, but I think sort of taking this piece into account would potentially inform treatment even further, that if delay is something that could have an effect on how we respond to food, that, or at least that could affect how we respond to food in contrast to other rewards, that, or if we're making sort of a forced choice there, that that could potentially be helpful. Um, but I don't offhand know of treatment outcomes at Yale right now. But it's definitely something that
Well, one of the things that
would be worthwhile.
is sort of a standby technique for dealing with brief surges of desire, whether for drug or other rewards, is to, we used to call it, build in a delay, so
Mhm.
that if the person can sort of surf the urge or hang in with it for a bit, that basically is inserting a delay. And we, clinically, you can sometimes frame that as, okay, the person's demonstrating themselves that they're not going to melt down if they don't get the cocaine, or if they don't get the opioids, or if they don't get the Oreo. But the idea is also, just now that you have these kinds of data, is that there's a really good, delay discounting understanding of, if you can, tell yourself that it's not going to happen for 5 minutes, make a deal with yourself that you're not going to do this for 5 minutes, then it may have less power
Yeah.
for you. And
Or
that,
the
that's kind
actual larger, the larger reward of, whatever else it might be, increased health and
yeah.
or
And
whatever, becomes
that
more
kind of
potent in and
decision
of itself.
making, which is very, that kind of decision making is sort of tough when you're in this
Yeah.
all, all heated up kind of state. But even just the simple concrete thing of inserting a delay in some kind of artificial way, but bet with yourself, do something for 5 minutes, something else, and you say the reward is not going to be available to me until after 5 minutes. It may be helpful, obviously, for food and drug. We are creatures who discount delayed rewards, and it is a variable that goes across people.
Hmm.
Some people can delay for quite a long time. By the way, a complete sidebar in terms of how much that predicts about other things in your life. Everybody knows the old marshmallow test and the Michelle papers. I saw a recent one, and this does go to the topic of individual variability, showing that kids currently, when they do that kind of delay of gratification test, can you hang on? Can you insert a delay? Who's better at it? Does it correlate with anything? That kids now are able to delay in essentially the updated version of the marshmallow test, as though there's some cultural shift. And I don't know if it was the context, if it was the studies. Maybe we should read those papers. But
Maybe.
basically, I was curious to hear that, because, only a few years ago, they were impressing us with the fact that kids' performance on that task was predictive, associated with all kinds of later life benefits, right?
Hmm.
Even though there was a whole developmental trajectory that occurred after that and all of that, and many life things, that how you were on that very early test could predict other kinds of positive
Well,
life
there's a lot
benefits.
of research
So,
going on with babies from infancy to early childhood, timing them on screens And of course, there are people who, and I'm impressed by the data, actually. I voted to get it into DSM-5. But the um, screens, in other words, your cell phone or your computer, are highly addictive, and they have very brief latency.
Mhm.
It's already in the as a disease, a mental disorder, in the ICD, and we put it in DSM-5 as needs more research.
But it's
But
sort of interesting to think about which direction the prediction goes, right? Because um,
For
some
sure.
would argue that because you have all this immediate gratification with the screens and the games and all the bells and whistles, that might be pushing you toward being not so great. But depending on the kinds of games you're playing and being patient and getting your rewards and earning the next level, I mean, maybe there is some more pervasive effect on essentially learning to delay, which, whether that will still have enough variability to show prediction later, or whether it will destroy the old marshmallow kind of prediction. It'll be interesting to see which direction it goes in. But the implication is, and I don't know the study, we should look at it, I should look at it before I talk about it, about what the exact cohort was when they were making this broader statement that young children at this stage are doing much better in the classic marshmallow kind of test.
Yeah, I know
No.
the original Michelle study was just preschoolers of like Stanford professors.
Mm-hmm.
So a very specific, or preschoolers who were enrolled in the preschool at Stanford. So a very perhaps not the most
Totally,
generalizable
totally
sample.
representative of the U.S.
Yes.
population.
And something that certainly has come up in delayed discounting research is the necessity um, of testing for income amongst your sample, because in some cases it's actually sort of adaptive to make that smaller sooner choice.
Absolutely.
Um,
What if
if
the future's
your
not guaranteed?
light bill
Yeah,
is going to go off, if your
right.
electricity is going off tomorrow, you need the $10
Yeah,
now.
a shorter
So
temporal horizon could be adaptive in a very uncertain environment, right?
absolutely,
So if you have
yeah.
no assurance of tomorrow and there isn't really a long tomorrow in your
Hmm.
immediate family, in your schoolmates, in your day to day, then what's the point, right?
Yeah.
What's the point of talking about next Saturday or next month or at the end of the year
Mm.
when you can't really project yourself beyond the day as a
And it
group,
may not
not
be a
just as
reflection
individuals?
of
Yeah,
impulsivity in that case, but sort of, you know,
yeah, more culturally
weighed
impacted.
choices and
Yeah.
yeah.
So
Um,
again, that's why it's important to look at the sample. That's why I said I
yeah,
shouldn't be talking without
absolutely.
knowing what the sample is for these kids that are quote unquote even better now than the what turns out to be the Stanford kids.
And
Um,
I hadn't seen the updated study. I'll have to look for that. But to the point about screen time, I think it's the assumption is absolutely that it creates sort of a shorter attention span. Um, but it also, I know, is very dependent on the type of screen time and the type, the sorts of
right,
things that people are
right,
watching.
right.
It belies my, sort of uh, my home interest. But I have a preschooler, and um, there was some research comparing sort of standard, screen, kind of generalized screen time versus, I believe it was Daniel Tiger, which is an offshoot of Mr. Rogers' Neighborhood, that when parents engaged in sort of were a little more engaged in the screen time, which in some cases probably not invalidates, but it is not how most people use screen time.
Right, right.
But if the parents are sort of pointing out, like, oh, look, Daniel's helping his friend, or, that, oh, he apologized, or, just kind of pointing out the empathetic things that Daniel was doing, that it was actually sort of a more beneficial kind of screen time.
Yeah,
And that, but that, there are certainly I think as well comparisons across things like TV versus tablet, and there are a lot of different variables there that will be interesting to see sort of what the long-term research is in some of
Yeah.
these kids, and certainly after the last year, where
Oh boy.
where screen time has increased quite significantly for good reason in a lot of cases. Um, so there will be kind of a I remember at some point last year mentioned to my husband that it's going to be kind of like the Dutch, the Dutch famine cohort, that like we're going to have this cohort of children that will have had a very unique experience in their lives.
Yeah.
Hopefully, arguably, knock on wood, not to the same detrimental effect um, as those kids, but that there's gonna be some real interesting research to see sort of what happens when there's this dramatic increase in screen time, when there's this dramatic change in sort of reward structure, really, just or the balance of rewards. Far fewer social, far greater access to snack food throughout the day, greater access to screens.
Yeah.
It's going to be at you know there'll be some interesting data for sure.
Yeah. We're all part of a great uninvited natural experiment, and
Yeah, for
um,
sure.
I can tell you that I did decide not to buy Oreos this week for all the obvious reasons. But anybody have any other comments, thoughts, or questions for Ali or for Serge Ahmed? We can relay them. Anybody else?